Good afternoon. Myself, Shradha Malla, working as a nursing tutor in Devbhoomi Institute of Nursing, DBOU, Dehradun. Today, I am here to present a topic on mental health in viral hepatitis. So, first of all, before going to the main topic, we will have a brief discussion or description about what is viral hepatitis. So, hepatitis is none other than it is the inflammation of the liver, as hepar means liver and itis means inflammation, and viral means because it is caused by the virus infection or viruses. So, in general, viral hepatitis means it is an infection that is caused by viruses, and ultimately it is causing the inflammation of the liver. It comes under various types A, B, C, D, and E. A and E are caused by ingestion of contaminated food or drinking contaminated water. Type B, C, and D are caused by blood. These all are blood-borne diseases, diseases by contact with contaminated blood or body fluid. Types B and C hepatitis can lead to chronic diseases. Then what is the need of means occurring or telling the or combining the viral hepatitis and mental health? As we know that viral hepatitis is a physical illness. So why do we need to associate it with the mental health? Because it can lead to many complications regarding mental health, mental illnesses. So first of all, we will see what is mental health. Mental health is none in general terms, it is a balance between the environment and the individual. Environment can be which lies within the individual, and external environment which lies outside the individual. Other than individual, everything in the surroundings comes as an or act as an external environment. So if there is a disturbance in the internal or external environment, it can lead to or it can complicate to things and can further lead to mental illnesses or psychological disturbances. As viral hepatitis is a physical illness, we know it is a physical illness, and it is an inflammation of liver, that means which is lying inside the person's body. That means there is an disturbance or disequilibrium in the internal environment of the individual. So there will, if it is the disturbance in the environment of the individual, it is ultimately leading to mental issues or mental illnesses. When any individual is diagnosed with hepatitis, they might or they have very strong reactions, psychological reactions like fear, anger, anxiety. They became anxious about the condition and all. Then mental illness and hepatitis usually co-occur, which means they will occur simultaneously. They will occur means if the person is going through the hepatitis or the hepatitis, it can in early stages, or if they are not able to cope up with conditions, they might fall into mental illnesses. They are prone to develop infections like viral hepatitis. They are means the person who is already suffering from any kind of mental illnesses, like we can say the person who are using substances. For example, if we can take then substance use disorder patients. No, they are already ingesting the drugs and alcohol, which is ultimately affecting their liver. So the mental illnesses also, the person who are mentally ill can also develop infection like viral hepatitis, like they are sharing the needles while using the drugs, and if they are taking alcohol, it is at last it is affecting their liver. So likewise, the mental health or mental illnesses can develop the infection. These viruses are linked with psychiatric conditions in both adults and children. This is the data which is defined according to American Association for the Study of Liver Diseases. It says that the viruses are linked to with the both adults and children. Like it is not limited only adults or adolescents. It is linked with the both. The psychiatric conditions are it is linked with the both adult as well as the children's childs. Then hepatitis C virus are usually associated with more risk to develop anxiety, depression, and insomnia. Why we are saying that hepatitis C virus are usually associated? Because it can lead to chronic complications, chronic condition. If a person will suffer for a long period of time and they are not able to cope up with the situation, they are not able to handle with the issues, the side effects and other things, then ultimately what they develop, they will develop the psychological symptoms like anxiety, depression and insomnia. And these all are the most common risk kind of mental illnesses that you can see with the patient of HCV. Then counseling. No, what is counseling? It is, in general terms, it is a conversation, or it is a therapeutic approach between an expertise person and the individual who is facing the problem. To what they are doing? They are doing having conversation or having the therapeutic approach to limit or to minimize their risk or other kind of things, and it will help them to resolve out or limit out their issues which they are facing with the help of a expertise person. So why do we need counseling? What is the need of the counseling, or what counseling will help? It will help us to promote testing awareness. Like if we say, if the people is not aware about what is hepatitis and what is the seriousness of the hepatitis, they won't go for testing and all. No, or due to the stigmatization, the person don't want to go to the testing. But it is seeing the seriousness of the condition, the counseling what will help? It will help promoting testing awareness by how? By giving awareness, by giving knowledge, proper knowledge, authentic information, by providing authentic information to the individual. It will create awareness and develop the knowledge capability of the individual, and ultimately it will help to increase the amount of testing awareness. Then second, it will focus on specific population. As counseling is a therapeutic approach, so it will specify the population, those kind of population which is at higher risk to get the hepatitis infection. Then it will create an enabling environment. Enabling environment, it will give a person or individual a suitable environment. Those fears, those anger, anxiety, which might be dissolved, or that impact has been can be reduced by going to counseling. The person will be getting the enable environment, like if they get positive also, they will get those counseling session and those therapeutic sessions. They will able to cope up with the situation, or all the factors, that all the issues they are facing during those times. Then ultimately it will reduce stigma and discrimination. Most of the cases, the person or the individual or the family members do not want to disclose the information, or do not go for screening or testing awareness kind of activities, due to the stigmatization. What if we get positive, then what other people will think about us, what family members will think about us, what my partner will think about us. So all these things can be reduced with the help of counseling, because in the counseling, the counselor, the therapeutic person, the healthcare provider will give proper information and knowledge to the individual or the family members, give authentic information, give them the preventive measures, tell them about what can be done, what cannot be done. So it will ultimately raising their awareness, raising their knowledge, and decreasing the stigmatization and discrimination. Then WHO has given 5 C's for hepatitis testing. While if a person is going for hepatitis testing, and if a hepatitis testing is going to done in a patient, what are the 5 C's that a healthcare provider has to keep in the mind? Those 5 C's were consent, confidentiality, counseling, correct, and connection. So in that, first C is consent. Consent means kind of permission or information So must give, the healthcare provider must give the informed consent. Now, if the patient comes, so if we want them to go for a hepatitis testing, we must provide the informed consent. We have to take the consent from the individual. Without their consent or without giving proper information, proper consent, we can't do the hepatitis testing. In that, verbal consent is also sufficient. Then every individual who are going to be tested for hepatitis has right to decline it. No, if the individual doesn't want to do or go for the hepatitis testing, they have the right to decline it. But as a healthcare provider, we must establish such kind of therapeutic approach or therapeutic interpersonal relationship that we will try to convince the patient to go for the hepatitis testing. We don't force the patient. Then each person has a private opportunity to opt out of testing. Like this, they have right to decline or they have opportunity to opt out for the testing. Then second C is confidentiality, which is most important. Now, why the person do not want to go for the testing and awareness or any other kind of procedures? Because of the stigmatization or because of the fear that their information might get leaked. Now, what if other people get to know they are having hepatitis and they are not able to get the treatment and all? So confidentiality is the must. Ensuring a confidential setting and preserving confidentiality. We must ensure the individual that their information, either their personal information or their test information will not be leaked. It is confidential. We will not share any kind of information without their consent. Not only to test result but also to other personal information. लाइकवाइज कि जरूरी नहीं है कि हम सिर्फ टेस्ट रिजल्ट की कॉन्फिडेंशियलिटी बना के रख रहे हैं. वी डोंट हैव टू शेयर और वी डू नॉट शेयर देयर personal information also as for the gossip matter. We do not. The lack of confidentiality discourages people from using testing services. What will happen if we do not maintain the confidentiality? Ultimately, the person will lose the trust upon us. No, the testing services for testing services, for treatment services, they will lose our trust. No, they won't trust us again because they are having lack of confidentiality matter. Then next is counseling. As we know, counseling is very important. Why? Because to aware the person, individual and their surroundings. All people should have the opportunity to ask questions. In that counseling, it is a counseling is what? Counseling is a process. It is a therapeutic process, therapeutic approach where the individual make therapeutic relationship with the healthcare provider or with the expert. So ऐसा नहीं होना चाहिए कि only the person or the healthcare provider is giving information, only giving the information and not giving the opportunity or any chances to the individual to clear their doubts. No, so every individual जो भी टेस्टिंग या काउंसलिंग के लिए जा रहे हैं उनको क्या हमें करना है? दे गिव देम अपॉर्चुनिटी to ask the questions to clear out their doubts. Whatever issues they are facing, उनके doubts को हमें, उनकी जो queries हैं उनको हमें क्या करना है? Clear out करना है. Then post-test counseling after accordingly कि what after post-test, whatever the result, if the result is positive, then what kind of measures they have to taken. If the result is negative, what kind of measure they have to taken. All these counseling or all these information we have to provide in post-test counseling. Then question answer mechanism as well as supportive supervision and mentoring system to ensure the provision of high quality counseling. हमें क्या रखना है? क्वेश्चन आंसर मैकेनिज्म रखना है as well as supportive supervision रखना है. We as a healthcare provider, we don't go for dominating the individual. No, we have to have the question answer mechanism. Then next is Correct means the individual has the right to have the high quality testing services. If you, as a healthcare provider, if you know that the services that you are providing is not enough or not appropriate for the individual, then you have to refer the individual where they can get high quality testing services. Quality assurance, including it include सपोर्ट फ्रॉम दी नेशनल रेफरेंस लाइब्रेरी कि जो भी टेस्टिंग मेजर्स हैं या हेपेटाइटिस टेस्टिंग से रिलेटेड जो भी कंसिडरेशंस हैं, मेजर्स हैं, उनकी क्वालिटी क्या होनी चाहिए, अश्योर्ड होनी चाहिए. Then last C is connection. Connection is making a bond or link between something. So it has to make the linkage to prevention, treatment and care services should include effective and appropriate follow-up, including long-term prevention and treatment support. हमें क्या करना है? We have to make a link between all these prevention, treatment and care services. We have to provide a लिंकेज सिस्टम. ऐसा नहीं होना चाहिए कि हम क्या कर रहे हैं, पेशेंट को प्रिवेंशन की टेक्निक्स बताई, हम उनको ट्रीटमेंट दे रहे हैं, केयर सर्विसेज प्रोवाइड कर रहे हैं, बट हमने फॉलो अप नहीं किया ना. तो वहां पे क्या होगा, हमारा जो बॉन्ड है, हमारा जो लिंक है, वो क्या हो जाएगा, ब्रेक हो जाएगा. तो वो ब्रेकेज नहीं होना चाहिए. वी शुड मेक दी कनेक्शन. Then providing the pre-test information. Providing pre-test information means what all are the information, what all are the knowledges, what all are the things that we have to tell the patient or the individual before going for testing. Viral hepatitis. First, what we can give information about viral hepatitis and the benefits of testing for hepatitis B and C. We should briefly describe them, what is viral hepatitis and what are the benefits of it to get tested for hepatitis B and C, and the meaning of a positive and negative test result. If the positive, what is the meaning, कि अगर positive आता है, what is the meaning, and negative test result है तो उसका क्या meaning है. That all information we have to provide before the testing. A brief description, prevention option. Second, what we have to tell about a brief description of prevention option. What all are the prevention option the person is having? Now, what all things they have to keep in mind if they are getting positive or if they are getting negative? What all are the prevention methods, prevention option, how they can prevent themselves? Then the confidentiality of the test result as well as any information shared by the patient. Like we have seen earlier also, the confidentiality is the must of the test result. Whatever test, we have to assure the patient or the individual that whatever test result will come and whatever information, whatever news they are giving to us, they are sharing with us, is it safe with us? Okay, we do not leak their information or we do not leak their test result, so that to establish the trust between or to establish the therapeutic relationship between the patient and the healthcare worker. Then post-test counseling and services for those who tested positive. Now, those individuals who tested positive, so what are the counseling services for them? First is provide clear information on further tests to be provided to confirm of stage liver disease. Who test is positive, which means they are diagnosed or with the hepatitis. So we have to provide clear information or authentic information on what all are the further tests that has to be provided to confirm the stage of liver diseases, because the person is already suffering from hepatitis. The liver has been or started to being damaged. So we have to see or tell the patient what are the further tests which we can do to assess the liver diseases. Then assess need of referral. We have to assess the need of referral. If according to the symptomology, whatever symptoms the person is getting, if they are manageable by us, then no need to refer. But if they are not manageable and the condition is worsening or the symptoms are chronic, or if we need to refer the patient in higher services, then we have to check that needs and refer the patient for higher care services. Then provide information on prevention of transmission and lifestyle modification. करना है उनको, now the patient has tested positive, so we have to provide information on prevention, how not to spread it to the other members and how to prevent it as early as possible. And lifestyle modification, how the person modify their lifestyle, like if the patient is substance abuser, so we can provide information like to cessate the substance, no, to take de-addiction treatment or other modalities. Then family screening and vaccination is most important. Why? Because the patient is positive, no, so now we have to tell the patient or motivate the patient to have the family screening, the screening of the family members for hepatitis and appropriate vaccination. If they have done the vaccination, then go for titer level checking. If not, then go for the vaccination. Then post-test counseling and services for the patient or individual who tested negative for the test in the result. First is explanation of the negative result. We have to explain about the negative result, that they have been tested negative. Then offer hepatitis B vaccination. If the person is not vaccinated or the family members have not vaccinated, we have to offer the HBV vaccination. If they are vaccinated, then go for the titer level checking and other procedure. Then repeat testing of hepatitis C virus if patient of high risk group. If the individual or the patient belongs to the high risk group like healthcare providers and other etc., so we have to inform them to have the repeat testing, periodical testing for hepatitis C virus. Then counseling. In counseling, the medical provider, what can a medical provider should counsel patient? First of all, risk for the disease transmission to the family members. No, the patient is already diagnosed with hepatitis or infected with the hepatitis virus infection. Then we have to tell the risk, how the person is susceptible, the family members at the risk to get those diseases, get the infection from the individual, from the person. No, so what all measures or what all are the risks that has been need to be noted to reduce the disease transmission family members. Then if there are couples or family counseling requires additional training. Why? Because couples education is very important. You know, if the partner has been diagnosed with the hepatitis, you know, so how we have to deal with the conditions, situations. So for that, to handling those couple or family counseling, the person or the counselor, the healthcare provider requires additional training how to handle the situation. Then in case of partners, if the partner, one of the partner has got hepatitis infection, then what all are protection method they should be using. Then in case of household members, tell them not to share razors or toothbrush because it might increase the risk of disease transmission to the family members. Then behavioral health counseling. If we are dealing with mental health in viral hepatitis, so what is the meaning of behavioral health counseling? Behavior, if the person is getting mental illnesses or mental conditions, the overall impact of the person will go on we can see in behavioral pattern of the individual, either in cognitive or like mental processes, cognitive like their activities, or affective their expression ways. So behavior pattern of the individual get disturbed if the person is not in that condition for a prolonged period of time. So we need to address those behavioral, जो maladaptive behavior person adopt कर रहे हैं, उन maladaptive behavior को we should try to change into adaptive behavior. So what all are the health treatment which can facilitate those changes? The first is, फॉर गिविंग बिहेवियरल हेल्थ ट्रीटमेंट प्रोवाइडर्स नीड टू, जो हेल्थ केयर प्रोवाइडर्स हैं उनको क्या चीजें पता होनी चाहिए? फर्स्ट इज द नेचुरल हिस्ट्री ऑफ हेपेटाइटिस सी वायरस इन्फेक्शन, कि हाउ दैट हेपेटाइटिस, हाउ दैट इन्फेक्शन हैज बीन अकर to the patient, है ना? What are the sign and symptoms, what all are the risk factor, what all are the causative factors, no? What all are the treatment measure, why the testing is important, why the what is the importance of taking the treatment, screening, all those things, what all are the options. These all things will comes under the natural history of hepatitis C virus or hepatitis virus infection. Then second, standard treatment. Standard treatment means authentic kind of treatment, which means we have to tell overall treatment consideration, what all are the things, what all are the treatment modalities, what all are the consideration that person might need to have. First, like in that we can tell about antiviral therapies, avoiding substance, if the person is substance abuser, to avoid those substances or sedate those substances. Then take precautionary measures if the person is healthcare provider, or if the person belongs to the high risk population, high risk group, then what all safety measure, what all precautionary measure they have to take. And the importance of the vaccination, है ना? If they haven't gone for vaccination, get vaccinated, like that. Then common adverse effect, as the every individual is different, every individual will means have different kinds of adverse effect. So some adverse effects, some basic or common adverse effect that person can get as bad taste, mouth ulcers, insomnia, skin irritations, hair loss, fever, chills, cough, diarrhea, fatigue, nausea, headache, so or injection site irritation. So these all are the common adverse effect that an individual can face. In next, we will see how to manage those adverse effects, no? One by one in detail. So first of all, if the person is having bad taste, no? If the individual is having bad taste, so as a healthcare provider, we can advise them for the bad taste to take sugar-free lemon drops. No? Lemon drops they can take, which is sugar-free, or drink lemonade. They can take yogurt before 30 minutes of their meal in a very small amount. Then brush their teeth frequently. Then they can try dark chocolates for bad taste. Then next is mouth ulcers. Mouth ulcers or dry mouth. No, for mouth ulcer or dry mouth, they can brush their teeth frequently, especially after eating the food. Then avoid those kind of mouthwash which contain alcohol in it. No, you have to tell the individual that they have to avoid those kind of mouthwash which contain the alcohol, and they can drink plenty of water. Then next is fatigue. If the person is complaining about, or the patient is complaining about fatigue, then you can advise them rest. No, tell the patient to take rest as much as possible. Then modify their work schedule if possible. If individual can modify their work schedule, then they can, as much as possible, or if possible, so they can modify their schedule by lessening it, decreasing the extraneous kind of activities. Then don't do extraneous kind of exercise, do light exercises like walking, jogging, like that exercises they can do, and avoid extraneous kind of activities or exercises. Eat well-balanced diet, which is prescribed by the dietitian, which is as ordered by the dietitian, and drink plenty of fluids. Then next will be insomnia. For insomnia or sleeping disturbances, first of all, avoid day sleeping. If the person or individual take naps in daytime, then tell them to stop doing that, because it will reduce the sleep. The sleep cycle will get disturbed, so daytime nap should be avoided. Then develop a regular routine for bedtime. No, do not change the bedtiming routine. Like if the person sleeps at 9 p.m., 10 p.m., so they should fix their bedtime routine at that time only. No, and use the bed for sleeping only, not reading or eating other kind of things. Use relaxation techniques like soothing music. They can listen, they can take a warm bath before sleeping. They can take massage like that. Then avoid extraneous exercises. They can avoid caffeinated products. They can avoid like coffee and all. No, at bedtime. Then they can limit their fluid intake before, at least before 2 hours going to the bed, and avoid heavy meals, getting or eating heavy meals at night. Then for poor appetite or anorexia, and if they are not they are not trying or not having the meal properly, then tell them to take a small and frequent meal. Do not take a large amount of meal. Do not take or have a small large amount of meal. Just try small and frequent meal and meal that is high in protein. Then for nausea and vomiting, eat small meals. Like that, do not eat at once. Eat small and frequent meals. Avoid spicy and greasy foods. Avoid those kinds of food whose smell will trigger the nausea or vomiting. And you can try ginger tea also. Then for diarrhea के लिए avoid spicy and acidic food. Those kind of food which is very spicy and acidic. Drink enough fluid, drink plenty of fluid. Then have roughish diet or fiber rich diet. They can include bananas and diet which is meal that is rich in fibers. Then for cough, drink more water. Cough drops without sugar coated. Sugar free take cough drops they can take, or they can try ginger tea. Then rashes, for rashes or dry skin or for skin irritation, they can use lotions, moisturizers, petroleum jellies. You can use gentle soaps. Tell them to use gentle soap, not harsh soaps. And apply sunscreen if needed. Whenever needed, apply sunscreen. Then for fevers and chills, because they are having an infection, so it is most common to have fevers and chills. So for fevers and chills, they can take medication as prescribed by the doctors. They do not tell them do not take over-the-counter drugs. No, do not self-medicate themselves. They take the drugs, tell about your condition to your healthcare providers, and then after consulting, after the prescription, take those medication only. They can try tapered sponging or cold sponging also. For hair thinning and hair loss, they can use wide tooth comb brush, means जिनके दांत थोड़े चौड़े होते हैं. Then avoid harsh shampoos. Hard shampoos they have to avoid. For headache, they should try to avoid bright lights. They should use dim lights or avoid bright lights. It might get irritated, or it can increase the intensity of the bright lights, can increase the intensity of the headache. Then drink plenty of fluids. Then infection or injection site reaction. The other adverse effect is injection site infection. So, or injection site reaction, what they have to do, tell them do not rub the area. Now they might get irritation, they might have irritation, itching in that area, but tell the patient do not rub the area, apply cold packs in that area, or use cream or use any kind of lotion or cream which is provided by the healthcare professional only. Okay. Then how to work with the high risk population? How we can work with the high risk population? High risk population, those population which are very much prone to get the infection. So those for like healthcare providers and the partners, the family members of the person who is already suffering from hepatitis. So we have to what we have to work, how to tell them how to work with those kind of. तो फर्स्ट वी हैव टू टेल देम टू सपोर्ट, जो उनका सपोर्ट सिस्टम है उसको क्या करना है, स्ट्रेंथन करना है, उसको और क्या करना है, बढ़ाना है. Then important of restricting the substance use. If the person is taking substance, then we have to tell them about ceasing or taking the de-addiction or therapeutic measures to avoid it. Then motivate them to ask their queries, whatever doubts, whatever queries, whatever thing the person is having, whatever anything, let them know you are here for them. You will clear their queries, clear their doubts. So let them ask the question, motivate. Sometimes person hesitate to ask what they are feeling or what they are thinking. So we have to build such kind of relationship. We have to motivate the person to what, to ask the questions, whatever doubts they are having, to clear their doubts, because it is very much necessary to provide authentic and proper information to the individual. Then get screened, if working with a high risk population, if the person or individual themselves, if working with a high risk population, the vulnerable population, then they should be timely, on time to time, they should get screened for the hepatitis. Then know about basic consideration, what all are the therapeutic measures, what all are the preventive measures, what all are the consideration that has to be take. All those basic information the person should have, and what all are the actions they have to take to what, to improve their lifestyle or to improve their life, healthier, to become healthy in life. Then management of what, mood and cognitive changes. As we are seeing mental health in viral hepatitis, which means viral hepatitis is ultimately leading to mental illnesses like mood disorders and cognitive changes or behavioral changes. So how we have to manage them, because the person is already suffering from physical illness, and now those physical illnesses has showing the complications or adversing the effect by developing mental illnesses or psychological changes. So we have to motivate the patient to stick to the treatment, adhere to the treatment, complete their treatment course, tell them about the treatment available, all the options that has been available. Now those mood changes, behavioral changes the person is having, we need to assess that properly, and accordingly we have to provide treatment facilities to the patient or the individual. Then treatment approaches. Use effective counseling strategies, including motivational approaches. No, like tips includes, first is ensuring safety of the counselor. Now, first of all, what we have to do, we have to ensure the safety of the counselor or the healthcare provider. हमें क्या, till now we are seeing the ensuring the safety, prevention of the individual, their family members, their surrounded members, but we have to approaches, effective counseling strategies or motivating approaches, we have to ensure the safety of the counselor. हो सकता है कि while having the counseling session, while having the treatment measures or taking the treatment therapeutic procedures, the person might bleed. They have rashes, so they have been bleed out. So in such cases, the counselor, the healthcare provider should see their safety and take all the appropriate or necessary measures like use of universal precautions and other kind of things. Then providing reliable information about hepatitis. हमें क्या करना है? We have to give authentic information which has been authenticated. Authentic sites से हमें क्या करनी है? We have to provide correct information to the hepatitis, haphazard or हाफ नॉलेज इज वेरी रिस्की. तो ऐसा नहीं, अगर किसी चीज की नॉलेज हमें नहीं है, इंफॉर्मेशन नहीं है, देन वी शुड टेक केयर ऑफ आवरसेल्फ फर्स्ट. वी शुड टेक इंफॉर्मेशन, वी विल कलेक्ट द डेटा, देन ओनली वी शुड प्रोवाइड इंफॉर्मेशन टू द इंडिविजुअल. हमें उन्हें मतलब अननेसेसरी और गलत इंफॉर्मेशन नहीं देनी. Then building the therapeutic relationship. Unless and until we will have a therapeutic relationship with the patient, we can't go for any kind of things. Any things cannot be done, because if we as a healthcare provider didn't develop a therapeutic relationship or didn't build a therapeutic relationship with the patient might not be able to trust you or share the informations. So it is very necessary to have an empathy kind of relationship, about and maintaining the therapeutic interpersonal relationship with the patient for the therapeutic purposes. Then helping clients understanding their diagnosis. How we can help the client to understand their diagnosis? Providing them the proper knowledge. If we clear their doubts, if we provide reliable information, provide knowledge, support, then it will what? Their prognostic factors, what are the good prognostic factor, what are the prevention method, and what kind of scenario they are in, what kind of problem they are in, the seriousness of the hepatitis. So it will help the individual to understand their diagnosis better, and it will help them to get ready for the future. What all kind of means, it will help the, but with all these treatment approaches, what we are trying to do, we are trying to make the patient ready for the treatment, because as we can see, it is a prolonged chronic, the hepatitis B and C can lead to a chronic condition, so it will take a chronic time to get treated. Then next, incorporating clients' needs in substance abuse treatment planning, which means patient, if the patient is using substance, already they are suffering from hepatitis and their liver is damaged. So if they will take substance, then in condition, these all conditions will worse the situation for the individual only. So we have to incorporate clients for needs in substance abuse treatment planning. We have to provide them knowledge or tell them about the treatment modalities which can be used for substance abuse treatment. Then developing a plan to prevention. What we have to do, we have to develop a plan to prevention. Plan to prevention means we have to provide what all things we can do to reduce the spreading, to reduce the spreading of the hepatitis to other members. So we have to develop a plan according to seeing the severity of the individual. हमें क्या करना है, डेवलप करना है एक प्लान ऑफ प्रिवेंशन, जो क्या हेल्प करेगा, विच विल हेल्प टू in the view of to limit the or to reduce the spreading of the hepatitis. Then using motivational approaches, we have to use motivational approaches to give hope to the patient, so that they can cope up with this situation, so that they can mentally prepare themselves for what coming in the future, or it is a long-term treatment. So what all treatment, what all things, what all modifications they have to do, we have to use the motivational approaches appropriately. Then confronting the social consequences of disclosing hepatitis status, है ना, हमें क्या करना है, confront करना है patient को कि what all are the social consequences, what social consequences they can get if they disclose about their hepatitis status. So they can have fear, shame, they can have social rejections. So all these social kind of social consequences we need to address if those things has been or can be occurred. So what things can the person can do to avoid those situations or to move on from those situations. Then addressing relapse. Relapse means if the person is substance abuser and हो सकता है कि previously they have been substance abuser, अब उन्होंने treatment ले लिया है, they are not, but after getting diagnosed with the hepatitis, the person might again fall for the substance use. So we have to address that also, that what all are the triggering factors, what are their support system, है ना, what all are the what kind of thoughts they get, है ना, to start it again, like that. Then building support system, we have to, if the healthcare provider is always supporting the patient, है ना, but we have to strengthen or build the support system by empowering or by giving knowledge or information, preventive measures to the family members also, जो उनका family है, friends हैं, जो environmental है, जो surroundings है, उन सबको भी क्या करना है, हमें aware करके we have to build support system. Then providing effective case management. Case management, every healthcare provider should know about the basic medical healthcare professional जो क्या कर सके, give them a case है, जो current person है, individual है, which has been diagnosed with hepatitis, उनको क्या कर सकें, proper information, knowledge provide कर सकें. अगर उनको proper knowledge, proper awareness they will get about their condition, they will be able to understand their situation, understand their diagnosis, and it will be easy for them to stick or adhere to the treatment, and it will get effectively managed. Then stigma and discrimination. Lots of persons do not want to go for screening, testing, or any other kind of treatment modalities of things because of the social stigma and discrimination. So it is what? It is a marked disgrace associated with a particular substance. What is stigma or discrimination? It is a disgrace associated, किससे associated है? With a particular kind of circumstances. कोई ऐसा event हो गया, है ना, कोई ऐसा circumstances है, कोई ऐसी situations है, like in this we are seeing hepatitis, तो उसके लिए क्या है? Mark of disgrace. Then stigma is associated with lack of knowledge surrounding why the person is stigmatized. हम क्यों लोग उन्हें stigma हम देख रहे हैं, discriminate कर रहे हैं, because of the lack of knowledge, है ना. The individual or the other surrounding members, the family members, they do not have the proper information, knowledge about the condition, that's why they are discriminating and having stigma about the hepatitis or transmission of the hepatitis. Then fear of infection and lack of knowledge lead to breakdown of intimate relationships. What happens if the one partner get diagnosed or with the suffering from the hepatitis? The fear of infection to the other partner, because of the lack of knowledge, what will it lead to? It will lead to breakdown of that relationship, which should not be there. That's why to eliminate those stigma and discrimination, we should encourage or provide authentic and reliable information and get created awareness among the individuals, so that the knowledge level or the awareness level will get increased about the hepatitis. So it will ultimately lead decrease in the stigma and discrimination. Then how stigma can be reduced? By implementing positive message, है ना. हम कैसे reduce कर सकते हैं? By providing knowledge or positive message regarding vaccination, है ना, against the hepatitis, by raising awareness of hepatitis virus, by disseminating accurate information about transmission, what is the nature of the illness, how it transmitted, what are the causative factors, what are the risk factors. If we tell them about them, all these things, it will raise the awareness, which will reduce the stigma. Then we can take help to provide those kind of information to the public, and transfer those kind of information to the public by using online support groups and social medias. Then developing a plan. Developing a plan means how we can develop a overall treatment plan. First is identify a specific high risk incident. हमें क्या करना है? Plan किसके according बनाना है? According to the high risk incident. What is the event, or what kind of event, what kind of incident has more susceptible rate to get the for individual to get the hepatitis. No, उसके लिए हमें क्या, how we can specify or identify high risk group? First of all, we can focus on their past behavior. No, might be difficult for a client who feels shame or regret. Discussing one specific incident might be less onerous for the client, है ना. अगर हम फोकस करेंगे सारे पास्ट बिहेवियर पे ना, तो पर्सन जो इंडिविजुअल है, क्लाइंट है, उसके लिए क्या हो जाएगा, डिफिकल्ट हो जाएगा, है ना. व्हाई? बिकॉज द पर्सन माइट फील शेम, फियर, है ना, गिल्ट. So what we have to do, we have to specify the incident one by one, है ना. Accordingly, we have to make the plan. Then ask the client to describe who, what, where, when, and how of the most recent risky experience. जो भी risky experience हुए हैं, incident हुए हैं, वो सब के बारे में हमें क्या करना है, patient से पूछना है. Then keeping in mind that some patient not know how they became infected, developing a risk reduction plan for this type of patient might require a gradual supportive approach to identify risk factors. In some cases, the patient might not know how they will get affected, how they will get how they became infected. It is possible that the person might not know. हमें उनके लिए क्या करना है, रिस्क रिडक्शन प्लान बनाना है बाय असेसिंग द रिस्क फैक्टर्स. हमें उनके रिस्क फैक्टर्स को असेस करना है कि व्हाट ऑल आर द रिस्क फैक्टर्स जिसकी वजह से पर्सन क्या हो सकते हैं, माइट गेट इन्फेक्टेड, एंड अकॉर्डिंगली वी हैव टू मेक द प्लान. देन आइडेंटिफाई अ सिचुएशन व्हेन द पेशेंट मिनिमाइज हिज और हर रिस्क. ना, ऐसी सिचुएशन फाइंड आउट करनी है, हेल्प करनी है इंडिविजुअल को फाइंड आउट करने के लिए, जहां पे जो उनके रिस्की बिहेवियर है उनको वो क्या कर सके, मिनिमाइज कर सके. Then synthesize patterns of behavior. We have to synthesize what all are the patterns of behavior the individual having. We have to synthesize it. Then revisit the plan periodically and assess progress. हमें क्या करना है, ऐसा नहीं है कि हमने एक बार प्लान बना लिया तो बस हमने उसी पे अडहेर रहना है. नो, वी हैव टू चेक द प्लान periodically again and again and assess its progress. If the progress is going on, then okay. If the progress is not going on, then we have to change or modify the plan. Then include vaccination against hepatitis and hepatitis B for prevention prevention strategies, or for other infections like HIV, AIDS that are spread in the same way as different types of hepatitis. Then addressing relapse, which means we have to protect the person from again using the substance. A diagnosis of viral hepatitis might increase a client's potential for relapse of alcohol or drug use. The diagnosis might all exacerbate depression, which are known triggers for an substance use disorder relapse. Now, the person क्या है, जो कंडीशन उनको हुई है, the person is getting affected with the hepatitis, हो सकता है कि उस हेपेटाइटिस, वायरल हेपेटाइटिस की वजह से उस cause is act as a cause for again starting the substance for the individual. तो वो हमें क्या करना है, we have to check, address करना है. The professional can start conversation about relapse. ना, जो प्रोफेशनल हैं, हेल्थ केयर प्रोवाइडर्स हैं, वो क्या करेंगे, they will start a conversation with the patient for relapse also. ना, by asking the question, what kind of things make you think about using again, है ना, what kind of thinking the person might have, or what kind of things or triggering factors are there जिसकी वजह से person को लगता है कि yeah, they might use the substance again. Or do you consider getting injections during treatment a possible trigger? हो सकता है कि अगर पर्सन ड्रग अब्यूजर रहा हो तो गेटिंग दोस ट्रीटमेंट इंजेक्शन फॉर ट्रीटमेंट पर्पसेस माइट ट्रिगर, है ना, माइट एक्ट एज अ पॉसिबल ट्रिगर फॉर अब्यूज. देन व्हाट काइंड ऑफ थिंग्स कुड हेल्प यू अवॉइड सब्सटेंस यूज, है ना. हमें उन्हें क्या बोलना है कि ऐसी चीजें हैं, ऐसे कौन से लोग हैं, या ऐसी कौन सी थिंग्स है, ऐसी कौन सी थिंकिंग है जो क्या कर सकती है, पेशेंट को हेल्प कर सकती है टू अवॉइड द यूज ऑफ सब्सटेंस. Then who could support you in these efforts? What all are the support system of the individual which will help him or her to not fall for again or having a relapse? How worried are you about the possibility of relapse? हमें ये भी उनसे पूछना है पेशेंट से और इंडिविजुअल से कि how much they are worried or what all are the possibilities that they might fall for the relapse again. Then there is a case scenario. In that case scenario, we will see ki what kind of how we can deal. No? So how lightly the person individual is taking the hepatitis and how we can address them. The Sarah, I don't see what the big deal is about hepatitis. I feel fine. So healthcare professional, hepatitis is a silent disease. It is a silent disease. You could go for years feeling fine while hepatitis damages your liver. And Sarah, so I get a little liver damage. I know lots of people will help with hepatitis who just live with it. Then healthcare professional, how they can address without getting argumentative with the client. What are the professional, how we can deal with it? Let's work together during our sessions to better understand what hepatitis is really all about. It's true that some people can live with degrees of liver damage depending on their overall health. No, person can live with the liver damage degrees, but it depends on how their health is. But if your liver gets damaged enough, it won't work anymore. When your liver doesn't work, you became very ill. Your liver performs hundreds of functions that keep you alive. Right now, your liver is removing toxins, storing the nutrients your body needs, producing the materials you need to digest food, and doing many other things. If your liver stops working properly, your quality of life can be seriously lowered. What kind of life do you want for yourself? Then what the Sarah, I want to feel good and to be able to do all the things I like to do. I didn't recognize that when a disease is silent, it can actually be doing a lot of damage. I guess I can't just ignore my hepatitis and hope that it will go out.